The Philippines is no stranger to earthquakes. With active fault lines running across the country, the threat is always there, especially for older buildings that weren't constructed according to current safety standards. But when it's a health facility, the risks are even higher. These are places that must remain operational to treat the injured and keep critical patients alive. But during disasters, older health facilities may not withstand the impact of a high-intensity earthquake, putting patients, staff, and essential services at serious risk. This is where seismic retrofitting comes in. Retrofitting strengthens these buildings, enabling them to better withstand earthquakes, reduce damage, and minimize injuries and casualties. To address this need, the Department of Public Works and Highways, with support from the World Bank and the Global Facility for Disaster Reduction and Recovery, launched the Philippines Seismic Risk Reduction and Resilience Project. The project focuses on retrofitting approximately 36 health facilities in Metro Manila, strengthening them to withstand earthquakes and other natural hazards, creating safer spaces for thousands of patients and medical staff and professionals. Retrofitting is more than just fixing cracks. Engineers assess the entire structure, adding reinforcements to prevent the building from collapsing during an earthquake. There are several retrofitting methods, each with its own advantage. Concrete or steel jacketing involves adding layers of concrete or steel around structural support to increase strength. Fiber wrapping improves strength with minimal intervention and weight, while steel bracing provides a supportive frame to absorb movement around the outside of the building. The project may employ innovative retrofitting methods using advanced technologies, such as seismic isolators and dampers, and other advanced retrofitting methods. Base isolators, like flexible rubber pads or slide bearings, are placed between the building's foundation and the structure above. This allows the building to move independently of the ground during an earthquake, thus reducing the amount of shaking felt by the building, protecting it from damage. Dampers, like shock absorbers in cars, are devices installed in buildings between floors and walls to reduce vibration and damage during earthquakes by dissipating seismic energy. These solutions usually minimize the disruption of the building operations and evacuation of occupants. However, the applicability of these techniques depend on site and building conditions. In addition to these retrofitting activities to keep health facilities safe, additional functional improvements are being considered to include needed facilities like wash facilities, inclusive accessibility features, and additional multi-hazard resilience features, such as measures for floods and typhoons. But health facilities must continue operating, even during retrofitting. That's why retrofitting approaches will need to consider the least disruptive engineering intervention, even if it may cost a little more to implement. Design and construction will follow strict environmental and social management plans. Measures like dust barriers, noise control, and restricted work hours help minimize disruption to patient care and other health facility operations. During stakeholders' consultations, the DPWH, contractor, health facility management, medical staff, and local stakeholders work together to plan phased retrofitting and temporary service arrangements. These may include the relocation of services and patients or the use of mobile facilities, so medical care continues safely. Retrofitting is an investment in resilience. A strengthened health facility protects more than a building. It protects lives, especially when every second counts. By retrofitting health facilities today, we're building a future where care never stops, even when the ground moves.